There are two other themes here I want to talk about. And one of them is that scientists are enamored of their tools. That means Philippe. They're in love with their tools. And people now have basically turned off their critical thinking and rely on their tools unquestioningly. And one of the things they do this with is the HIV antibody assay. They go and they test these populations, come up with 25% positive, 30% positive. It makes no sense. If they do that in Berlin, 30% positive, they send the test back to the laboratory for development, but it happens in Africa. Oh, different situation, makes sense here, doesn't make sense, okay? And again, as I'm saying, there are people who know that this can't be the people that know that in an asymptomatic population, that it should be a majority of false positives, but they're not speaking out, and it's difficult to go there. So that's one problem. It's a problem with the assays, and it's a problem with the computer data that's being generated out of Geneva and other laboratories. The other issue here that's a common theme throughout all the AIDS work is the belief that HIV has a 10-year incubation period. It does not. It's possible, okay, but this concept gives the idea that's the average. Therefore, it can go from 1 year to 20 years, and that's not the way it works, okay? I actually have a blog post about it. I actually have a blog post about it with a lot of data coming, and it can be as short as 2 months. Now, the real issue here is now that we have drugs that stop the replication of HIV, the incubation period is prolonged for a long time. And let me say also, incubation is the period from infection to where the first symptoms develop, okay? And in the old days when AIDS first started, that's what it was called AIDS. They didn't know what the cause was, but when you develop these particular infections that were opportunistic infections, that were infections that you never had because your body normally took care of it, and we had no drugs that were effective against it because we never had problems with these before, that's when you had AIDS, when these first things developed physically in the clinical laboratory, in the clinic, when you saw it in the doctor's office. So this permeates through all kind of issues with HIV. They use these type of incubation and longevity data when they generate the computer's data. It says that there are 30 million infected in Africa. And also you're going to see in a genetic study, they also link together these bits of genetic dust through time with the belief that, 10 years ago, something that happened could be related to HIV. It's not really the case. The other thing about this incubation period is that HIV is not people have this idea that you can have HIV for 10 years and you don't know it. HIV is not a silent infection. About 30% of the people who contract HIV, have a flu-like reaction in the first week, just like a normal viral flu, and it goes away. And then this is going back to the old populations that were well studied in the States and Europe before they had any effective drugs. But basically, the incubation period is actually the first while, it can be as short as 2 months. There's a few documented cases like that, but generally a year, 2 year is more the first wall of incubation. So basically in the States, they had said that going back to, say, before 1985 in those populations, once you developed an opportunistic infection, 50% were dead in 12 months, and by 5 years, 95% were dead. Okay, so that's the story. This 10, 20-year story doesn't make sense. Also in Africa, they're always finding all these children who are 10 years old, 5 years old who are infected. Okay, going back to a study of like 12,000 people in Italy, I think England and the United States, babies born with HIV infection, the average survival period was 6 to 9 months. Okay, so someone they find 3, 4, 5 years, 6 years, 10 years, and they're infected, they got it at birth, doesn't make sense. But that's all the case. You hear these cases in Africa. So it doesn't make sense, but they're testing positive. Okay, that's the issue. So as I was going to say, I'm skipping a lot of stuff, but science is a wonderful thing, but humans are involved.